All right, I'm Gisselle,
And I'm Vanessa.
and this is Insights with
With
Ignite.
We're going to be talking everything chiropractic, nutrition, and wellness, and what we do at the
Yay.
office, right?
Yeah, so we are the CAs. We run the office. We do everything in terms of payments, billing, phones, text. So if you got a phone text, we're the ones answering it. Laser, we basically quarterback the office.
Definitely. And just so you know, CA is chiropractic assistant, if anyone is wondering what that is. Yes, we are the quarterback. So anything that doctor needs, we're handing it up. We're taking care of it, basically. If we're helping with treatments, if we're scheduling your appointments, we're following up with insurance, with attorneys. We also get the fun times to go to networking events where we meet potential clients and patients.
Yeah,
What else do we do?
all that fun stuff. So Vanessa, we're actually celebrating your 2-year
Yes.
anniversary with the
I
office.
just
What is one of the biggest things that you've learned since working here?
Oof, big. See, I had only seen one chiropractor previously, and it was very minimal compared to what we do in the office, and I didn't understand it. The doctor back then didn't really take his time to like explain much, and I didn't know. So then when I started working for Dr. Joe, I mean, a whole new world came.
Right.
Right.
Yeah.
Like I didn't know how much of an impact chiropractic can be for someone. From TMJ to like migraine headaches to like
Yeah.
eating well is another really, really big thing. But that was my introduction to chiro. How about you? You're 3 years with Dr. Joe, right?
Yes, 3 years at the
Which is great.
office. I've been getting adjusted since I was little. So
Mhm.
I grew up as a child of chiropractic, I guess,
Yeah.
and which is really awesome. I actually want to be a chiropractor myself, so
Yeah.
that's the reason I came to the office. Um, I think one of the coolest things to see is like the philosophy being shared, like not only with our office,
Mhm.
but between chiropractors and sharing
Yeah.
that knowledge. I think it's really important to get the word out. And like obviously we want to like grow our business,
Mhm.
but also encourage other chiropractors to succeed. Like we all want each other
We're
to
all
grow
big
together.
brotherhood,
So
right?
I think
Brotherhood,
that the
sisterhood.
brotherhood between the
Right.
chiropractic network is really, really amazing. So
Yes. I mean, I've been blessed to be able to go to a couple seminars now.
mhm.
Went to Parker seminar, which is huge for chiropractic, and twice now.
Yeah.
And one at one of the schools that you're actually interested in, right? The wellness care up in LA. That was a lot of like just open to so much possibility, like how like I got to see befores and after CT scans of patients who had only been in chiropractic care where like, the spine just like flares up. And so that was really, really cool to see because I can see why they're teaching, why chiropractic is so impactful. And
Mhm.
it's not just medicines and pills. And I really, really love that. It's health and wellness. I don't want to be crippled and old and
Mhm.
needing medications.
Right.
So being in chiropractic, being able to like learn how to eat better, knowing that if I'm feeling ill or sick or waking up with a headache, Dr. Joe can adjust me and do
Yeah, that there's
things
other
because
options.
exactly
Right.
because we know it works, right?
Right.
How many patients have we seen where they come in like in so much pain, right? Oh, my head's hurting, or I had this and this happen. And even in just that one visit, they're walking out happy and thankful
Yeah.
and hey, I'm feeling better. Even more so when we see them coming back over and over again. It's like, no, we know it works because we're
Right.
seeing it literally walk through our
Well,
office.
not only like the patients that we see, but
Mhm.
also we've experienced it firsthand.
Exactly.
So
Right.
I think that's really special.
Yeah, I love it. I remember even just my own personal story when I first started getting adjusted. I'm
Mhm.
now 2 years in. I'm getting adjusted once a week, right?
Mhm.
And if there's a hiccup, if I'm feeling really ill, I'll get
Mhm.
adjusted again. It's twice that week or whatever it might be.
Right.
So I did notice like when I before I even came in, I've always worked at desks and offices,
Mhm.
and posture was always really bad, especially working on computers, right?
Right.
Soon as I started getting adjusted, a couple months in, I'm like, whoa,
Yeah.
my hip feels
You
better.
really
My
feel
knee
it.
feels
You
better.
really feel it.
Yeah. And then now we're all, most of us in the team are going to be doing a half marathon soon.
Woo.
So I've never freaking run a half marathon. So to be able to have the benefit of getting chiropractic care and our laser therapy, which we do carry a medical laser, just and then eating better and for this half marathon, it's going to be wonderful. I'm
I'm
set. I
excited
have a
for you
team.
guys.
Like
Yeah.
we have our support team. Like, hey, we're okay. I'm gonna survive. Yes, that sounds really scary, but it's fine. I'm excited. Yeah. So some of our frequently asked questions, or at least the hiccups that people wonder about, is like, how long is chiropractic going to take, or does it even work? We work with a lot of PI patients, right, where they're like,
Right.
I don't know if this is going to help, blah, blah, blah. And they come in, and after weeks of care, because they're coming in so often, they're like, oh no, I need to come back. I know that this is working now.
Right.
And we open them up to possibilities under chiro care. So what are I guess, one of your stories that you've seen that's maybe impactful as far as like even PI patients?
My favorite stories, or my favorite cases, I guess, are the
Mm-hmm.
people that are skeptics.
Yeah.
You see people come in and they might be coming in because they have to. They're part of they're in a car accident, personal injury case, and it's kind of like their protocol.
Mm-hmm.
So they're a little hesitant. They come in, they can't move their neck. And my favorite story was this patient that we had. He had never gotten chiropractic care before. He didn't believe in it. He was like,
Mm-hmm.
"Oh, like
How many
why
of those do we
why am I
probably
even
have, right?
here?"
Yeah.
But again, he still could not move his neck. He was in a lot of pain. So again, we adjusted. We did the laser therapy on his neck,
Yes.
and I remember I was the one doing the laser on him. So I would see. I was like, "Hey, can you give me range of motion?"
Mm-hmm.
And he couldn't. At first, he couldn't. He was having to move his whole body like that.
Oof, it's tough. Yeah.
By the third or fourth adjustment, he was able to move his neck. In like after the 12 adjustments that we
His treatment plan, right?
yeah,
His
his
treatment plan was at 12 visits.
exactly.
And at least in the office, just to like interrupt, in the office we do scans, so we were measuring as well, right?
Mhm.
So at his 12th visit, his 12th scan, you noticed.
Yeah, his after his 12th visit, he was able to have pretty much full range of motion, almost no pain. He said he
Yes.
had never experienced anything like that, and then he actually continued his treatment after his case was done, which
Mhm.
was amazing. I love that case, and I don't know, it's just really awesome to see people
Yes.
um understand the chiropractic philosophy and see it
Right.
work. And how
And
you said
commit.
not only getting them out of pain, but treating the issue, like correcting the issue. Because I
Right.
think that's another thing, another big misconception that people have is that you only go when you're feeling ill.
Yes.
It's not like the oncologist that you go because you have something that's wrong. Like
Right.
this is more of a corrective care, wellness care,
Mm-hmm.
not like we want to take the preventative approach
Mm-hmm.
versus the correcting, although it is effective for correcting as well.
Yeah, of course.
One of my favorite things that Dr. Joe said, it really stuck with me, when introducing chiropractic to people is
Mhm.
like you go to the gym and
I remember this. It's not a band-aid is basically what it is. It's not
right.
um chiropractic treatment is not a band-aid. You either it's for longevity. Like
Yeah.
you got to be committed to feeling better, to wanting to be better, to showing up to your appointments when you need to,
Right.
and coming in and getting that care and eating healthy, and because all that is all
Mm-hmm.
wellness,
And
right?
what I was gonna say, it's like the analogy that he used was you go to the gym consistently for a couple
Mhm.
months, right? And that's when you see the progress. And then you go in, maybe you can go twice a week to keep that progress, right?
Mhm.
I feel like chiropractic is similar where initially you need to get that movement into your spine so that
Mhm.
your body holds the adjustment much better. And then that's when you can go into the wellness care and go once a week, once every 2 weeks. And I think that one of the doubts that people have when coming into the office is how long am I going to have to come?
Mhm. One of
And
the big
our answer
questions,
is
right?
always like, well, how long do you want to stay well for?
Right.
Like, of course, you don't brush your teeth once and then call it a day. Like,
We hope
you have to,
not.
it's a continuous thing, it's a maintenance
Right.
plan. Whereas I think that that's one of the biggest misconceptions that people have.
Mhm.
So
Mhm. Where we do have patients that have seen Dr. Joe in the past, and they only want to come in like that one time, that the one time
when they
that they
need it,
have that neck
when they are
pain.
in pain.
But they sure enough do know that they come in because they come back in. They're like, "Hey, I haven't seen him in a while.
Hmm.
I need to get adjusted." And so we do have those patients who just aren't available to come in once a week. But our wellness patients, the ones who are coming in once a week, those are, I mean, they have kids coming in, and their babies and the newborns are all
Hmm.
coming in. So seeing all of them and having them understand the philosophy of it's not just a band-aid,
Hmm.
and you do need to commit to coming in and getting your adjustment. I think that makes a big difference in in all aspects of your life.
Yeah, and I think those are the patients that see the most benefit out of it, you know,
Right.
because you're continuing this care. Whereas how you said there are people that come in once or twice and then they feel sore and
Mm-hmm.
they get discouraged, which is
Mm-hmm.
one of the things that we try to inform our patients about, especially if it's their first time getting adjusted or haven't been adjusted in a while. Like, we understand that it is a commitment,
Mm-hmm.
but it, like, with the commitment, you will see the improvement, you know,
Huge.
because otherwise you get somebody that comes in, you're sore, and then they don't want to come back in, and then it kind of ruins it for like their experience, you know.
Right.
So I think that's
Or the ones who are scared of like the neck cracking, right?
right.
The neck cracking. And it's nice. I like that we have, and our office, it's open. So the people who are waiting in the lobby can actually see what's going on as far as what doctor's doing as far as the adjustments. Because those skeptics, they're watching, they're like, oh, they can do it. Oh, this is good. And just being able to see that and hear their, it's conviction for us,
Right.
for Dr. Joe, like, hey, this actually works. That's definitely one of the biggest misconceptions is like, oh, I only need it once, or how long do I need to do it? Well, and how long do you want to feel good? That's been one of our big drivers, I think, when trying to bring the patients in, trying to bring them back in and keeping them consistent with care.
Yeah, one of the things that I noticed that, or at least personally, that keep the patients in is Dr. Joe being so freaking smart. One of the things my mom always says is, I love talking to Dr. Joe because he's like a human encyclopedia. Anything that you ask him, he will have the answer to. You can ask him,
like, where did you get
why does this work? How does this work?
Yes.
What's going on with this? Even though you came in to get your neck adjusted, he's going to have information on why your big toe is blue now. Like, it's insane. And it's so in detail, which I think is very valuable as a patient when your provider is very well informed. He's so knowledgeable and he's going beyond just the treatment that you came here for. Like,
huge difference.
His knowledge, I guess, like,
huge difference,
is such a asset to our office, you know. I think that's one of the things. I mean, I've never been, I haven't met all the chiropractors. There are a couple of chiropractors that I've met here in San Diego that are very good as well and are like that. And I think that that's what sets them apart from the other providers I've seen, you know?
Yeah, they're going above and beyond. They are actually taking care in what you are needing and expressing.
And they want to educate you as well, you know? Because the care goes beyond the office, you know?
It does. It does.
Your body heals itself. That's what Dr. Joe is doing. He's the one adjusting, manipulating your spine.
Right.
Your body kind of does it on its own. But he also, I love that he like teaches the patients, hey, you need to do this exercise. You need to fix this in your diet. You know, like, it's not just the adjustment. He kind of makes it like a lifestyle, which I really appreciate.
There's one thing, I'm not sure if I'm saying it correctly, but where he says, I'm not healing your body. I'm just helping facilitate you
Exactly
to heal your own body. Because from all the seminars we've had, from the conversations that we've had with Dr. Joe, our bodies heal themselves.
Right.
He's just helping, right? And a lot of people don't understand that. Like, our bodies are well-oiled machines, and a chiropractic adjustment it's the oiling of them, the tune-up, and
yeah, exactly.
And that is definitely, I think, helps our conviction, especially just keeping people healthy, you know?
Yeah. Another thing that we wanted to touch on were the frequently asked questions. And one of the questions that we get most often is, how long will it take to see improvement? And as we all know, everybody's different. So your needs might be different from mine. Right. So that's why we like to do the assessment, the day one, evaluate, and go from there, give you your personalized treatment plan. Right. But one of the things that Dr. Joe always says is, do you want to put a Band-Aid or do you want to correct, which I mentioned before. So we really like to assess, I guess.
We're assessing. We're trying to get you out of the pain.
Right.
And those pains can usually have been over years, right? So yes, we want you coming back in. Pain is the tip of the iceberg. Offices that chase pain just see the revolving door. The patients, those ones that come in every once in a while, right? And we're like small. What are those? We've had patients come in from those revolving door type chiropractic appointments.
Yeah, and they see the difference.
They see, like, hey, I had a bad experience. I need to come here. And that's where Dr. Joe is educating them, right? Educating, like, okay, this pain has been caused by years and years of bad posture or whatever it might be. And so he's addressing those pain points, especially as far as keeping them on that care plan, right?
Right.
We love to assess. Like, we do the day one. We do it within, the next 12 weeks. We want to check. How was your day one? How's your 12th adjustment?
Right. I actually think that that's one of the things that sets us apart
Really
from
is.
other offices that I've seen, at least, that we like to take your day one and compare the before and after 12 adjustments. Typically we do the reassessment, and you see the reds go down, they reduce, the blacks go down, the asymmetry is slowly but surely getting more symmetrical, you know. And so I think that the patients being able to see that, even though they might not feel it, you know, the musculature shows it.
Right.
So I think that that's one of the things that, for at least for me, it made such a big difference to be able to show them, like, hey, it is working. Like, what
Yes.
you're doing isn't
Keep
just
on it.
a lost cause. Like,
Right.
yeah, you keep doing it, you stick with it, and you're gonna feel better.
For sure.
So that's one of the things.
That's
also.
definitely big. I even the foot scans, like when they see, oh, well, this is why, I'm having this low back pain. And so measuring has been huge in our practice, definitely.
Not only that, we also have, it's not just the adjustment, right? We do the class for laser therapy. We have massage in-house. We have acupuncture in-house. Like, it's a one-stop shop. So a lot of times it's more convenient for patients to have all these providers in one place and be able to get better instead of having to go to all these different places, you know?
Definitely.
So.
Definitely. I love that. And then working with in the PI world, the personal injury world, working with all these other providers has also opened up a lot of opportunity for us. Like, if someone needs specific care, like, hey, we know someone, and that's another thing about the brotherhood, right?
Referring
people, like, hey, we know
to trustworthy people who are local, not only a phone call or a Google search away. Like, these are people that we genuinely trust, have relationships with, and we know that if we need to send you off to an external provider, you are in good hands, you know. So
that is very big, right? Networking in a sense, just building that army of care providers, right? The acupuncture, the massage.
It's amazing.
Doctors telling our massage therapist, hey, I need you to work on this specific area for this patient, and the patient is obviously getting better, right? Because they come back in.
One of the things that we get asked is this only for me, or can I bring my family in? And I think that that's another good point to bring up, is this isn't for just one person. Chiropractic, everybody can benefit from it.
For sure.
It's not like the gym that you can only really have so many good years before you go or you're out, right? Like, we've had babies come into the office, newborn babies, 3 days old, and then all people on the other side of the spectrum that are barely able to walk, they're barely getting there, but they're still benefiting from those adjustments, right? So I think that that's like a doubt that people have, but once they see the value in chiropractic and they understand why it works, like, it's kind of undeniable, you know. Like, you're doing yourself a disservice if you're not coming to get adjusted.
Very true. And it's not even doubt, it's just they don't know,
right?
Like, people need to be aware of chiropractic. Like, me growing up Hispanic in San Diego, I didn't know what chiropractic was, right? Like, I had no idea until I've had that one encounter. I was like, hey, I'm having really bad low back pain. And the guy came and, brought me in, did an adjustment. That was it. And I was like, okay, I'm good. I don't need it anymore. Right. And then I got to Dr. Joe's office and I was like, oh no, he let us know, that's part of our care is we're getting adjusted once a week. Huge impact. Even just my interview day, like when I went in to like speak to him and like get to know what was going on, and that was a wealth of information. I was like, whoa, lots of information. I need to like really like take it all in. I had no idea how much
it is.
Does. And I mean, even me, like, I'm feeling really, really good. I'm almost 41 and
you look good, girl.
Thank you. I'm the healthiest I've ever been. And that's one main reason is chiropractic. And now, and then everything else kind of just branches out. Oh, I'm feeling good. I want to do better. I'm going to the gym more. I'm eating better. I'm like, I don't want to eat this crappy stuff. And not only that, the office.
I was going to say the office culture too. Yes, like, we all encourage each other. I love that. We're all sharing knowledge. We all want each other to be healthier, be the best version of ourselves. So that also plays into it,
Huge. I mean, we get our labs. We have a company that we use that we can take our labs. Like, I got my hormones tested recently and I thought I was almost perimenopausal, and when I checked I was like, oh, I'm okay. So but then I realized it wasn't perimenopause, but what is it? And it was my diet and what I was eating, and I was taking too much of certain things, and I was like, okay, let me take that back.
And it's nice that you have the resources to do so, right?
Huge. I never would have thought to get my my food sensitivity test. Like that was one of the first things I got when I first started
Right,
working,
yeah.
right? Like, hey, what foods are inflaming me? Okay, we have a test we can go ahead and run.
Mhm.
Dr. Joe submitted the order. I got my blood, and I was able to see the list of foods that were inflaming me, and that was
Mhm.
another huge difference. So that is all chiropractic. That's
Mhm.
all health and wellness.
Now that you mentioned
Yeah.
that, Dr. Joe had told us about a patient that he had came in and he said it was like adjusting a brick wall. He could not get movement in the
I
spine.
think I remember
And
this.
then he stopped coming in because
Mhm.
again, he's again one of the patients that
Comes in
come
blue
in and
haze.
yeah.
Mm-hmm.
And when he came back in for the next adjustment, it was like night and day. He was adjusting so well.
I remember this.
And he said, what did you change?
Yes.
Because something changed.
Mm-hmm.
And he said, oh, I actually went paleo.
Mm-hmm.
And that's when it clicked for Dr. Joe. He said, it's not just the movement and everything, it's your diet. Him having an anti-inflammatory diet was able to bring back the movement into his spine that he otherwise didn't have, you know? And that's another thing that Dr. Joe educates our patients on is your spinal health isn't only your movement or your environment.
Right.
It's your chemical stress, it's emotional stress, physical stress. Like these are all different types of traumas, so to speak,
Yeah.
that are going to your body that affect the way your body is moving and feeling and everything, you know? So that to me was insane because obviously we all try to eat as well as we can, but here and there some crumble cookies, you know, they get me. But
when the patients are bringing us donuts.
but you know, it really speaks volumes when you see the change. Like I feel like it really motivates you to take that step forward into your health, you know. It's an investment into your health at the end of the day.
It's a very big investment, but it's so worth it. I mean, we have patients who come in who pay out of pocket, the ones who can't get like insurance coverage for their chiropractic care, but they see and they know, yes, this is an investment, but I am feeling better. I want to be better.
Yeah, and at the end of the day, also you're again, it's an investment. It's high risk, high reward, I guess.
For sure.
But you put in the care now so that you can have those extra years in the future, you know?
Exactly.
So that you are able to play with your grandkids. You're not limited by whatever it is that you would otherwise not be able to do, right? Like this is an investment into your health, into your future. So
yes, I mean, how much do you want to feel better, right? How long do you want to live healthily and feeling good? I want to be able to like pick up and put my own socks on. I want to be able to lift and grab or anything like that. I want to be able to jump here and there without feeling pain in my knees or my feet or anything. I want to run this half marathon without, pain. I'm sure it won't be painless, but to be able to rely on, hey, I can get adjusted and I'll be okay. Or hey, I can do the laser on my feet, whatever it might be, and I'll be okay. But yeah, it's investment in your health, in your well-being, in your life,
and your happiness.
in your happiness. Yeah, we see how many patients do we see where like, oh, I'm in such bad pain, and until they start making it a habit to come in, they're not going to feel better until you make that commitment to yourself.
It reminds me of the episode of White Lotus where the lady goes, I'm not meant to be, or I'm too old to be living an uncomfortable life. Like that's what it is. You want to be old and be comfortable.
Exactly. Oh, that can go many ways, but yes, definitely. Yeah, it's huge. Like, and that's, I think, one of the biggest misconception is how long, why, like for how long, and how many times. But it all that all bottom line just depends on you and how much you want to commit yourself to feeling better. Bottom line. Period.
Period.
Do we have any other hiccups or people that are hesitant about Cairo? I think if anything, it's probably insurance or out of pocket mainly.
I think
we have
our biggest thing with that is just send us an email.
Yes.
If you have any doubts with the billing stuff, send us an email with your information and we'll check that before you even get there, you know.
Yes, exactly. If you have insurance, if we're within your network, we can cover that base at the beginning, or we have plans, and that's always really helpful and beneficial for patients, because we do want you to come in. We do want you to take care of yourself in coming. You got it. Some of the top things that we see with chiro patients who fail, as far as like getting better, it's the having the mindset of it's a one-time fix. It's not a one-time fix. Yeah, like we spoken earlier, we have patients that come in every once in a while, but the success stories are those ones who do come in. That's one of the biggest pain points, especially if they've had a pain point, like say the low back pain or the knee pain for years, right? You're not going to get fixed in one adjustment. You might
Well,
feel
again,
better,
it's
but
treating the root of the problem, not putting a Band-Aid on the symptoms.
exactly.
So.
Yeah. Failing to keep up with appointments. We find that especially
girl,
with
don't get me started. Don't cancel your appointments.
don't cancel your appointments.
No,
please.
it's fine. No, you know what? We're really flexible.
We
I
are,
think
we are, thankfully.
me out of everybody, I'm always late to everything, but it's not because like, we care. It's because you're not gonna get better if, or they're not gonna get better if they're not coming in. Especially like that's your complaint. You're in pain. We want to get you out of pain, but you have to show up for your appointments.
Right.
So,
and we're so accommodating. Like if we have had days where we had to close, we have to change a schedule or whatever. So yes, we are accommodating. We want you in. That's the point.
But we need to make it up.
Yes. I mean, Dr. Joe's coming in, 15, 20 minutes early if he needs to, or leaving, 15, 20 minutes late if we need to, but we want you in. That's a commitment for us. We're committing to you and we're going to get you better, but you have to commit to us that you're going to show up.
It's definitely a mutual commitment. And that's one thing about Dr. Joe that I appreciate so much too. He is so accommodating. Like he genuinely cares for his patients. He wants you to get better. It's not like the doctor's office where you go in and they don't even know your name. Like,
I know.
Like you're not just a number.
No.
And I think that's one thing that we've all really created this community at the office. Yes. And I hope that our patients feel that, that
so. I really do.
Like that they're not just a patient. Like they're part of the Ignite family, you know? Like I want to know about your life outside of the office. Like I want to know what your kids' names are and you know what I mean? Like
exactly.
That's something that
I think we take pride in what we do, and that shows in the care that we give to these patients from the moment they walk in, right? We have so many stories that we hear. Like one of our patients is running a half the Ironman week, right? So, and Dr. Joe's running Ironman, so he's been able to like have conversation and like, hey, this is what you're expecting, and this is what we're doing, and we're getting him better, and and he's about to race this weekend. He came this morning. He came in for laser, right? He's like, I'm ready to go. So, having conversations, like building that rapport with patients. I mean, I've come from office work and like healthcare, so building the rapport with a person is huge.
Yeah.
Something that you don't see quite often anymore.
No.
In certain circumstances, right? So being able to like, hey, how was your daughter's recital? How did your game go? And all that, like, hey, how's your elbow doing since we have the laser treatment?
Like that human connection. You're not just coming in for an appointment. Like you are,
you're not a number.
But you're not a number,
you're not
right?
A number. You are one of our patients. You are one of our Ignite family. Yeah, I love that. I think we do. I think it starts from Dr. Joe. From the moment I walked in, I mean, I met his son on day one, and I was like, oh, this is cool. This is like chill, laid back.
Mini Dr. Joe.
Yeah, mini Dr. Joe. But it's very professional too. Like obviously, we're not screwing around. Time is money for you guys, so we want to make sure we're touching all bases as far as care. But we're also getting to know you. Yeah. How many families have we had? Come in and they have their kids, or even with some of the
see some families grow
since
being there,
have followed Dr. Joe different practices because they know that chiropractic works, right? Because they know that their child is going to feel better after their adjustment. We had one our patient who just had a baby, right? And the little guy was having trouble pooping and not eating well, and mom had just had the baby, comes in and he gets his first adjustment. He was able to poop. Yeah. And now he comes in about once every 2 weeks or so?
Once every 2 weeks, yeah.
Once every 2 weeks. And he's being able to poop. He's eating better. And we saw him when he was a little baby boy. Well, we saw when she
in the belly,
right? And now
when he was just an idea, actually. And now he's here in the flesh.
Exactly. So we get to see the babies grow. And I think I love that. I think that's why I truly enjoy my job.
That's one of the best parts of the job.
Yeah.
That's why, like, that's why I like it.
Yeah, it really is.
To talk to people.
We have a couple families who've been with Dr. Joe for ages, right? And where he gets to see them grow and we get to see them grow, and they know who we are now. And it's like, I love that. Yeah. I think that's another testament to our care and the care that Dr. Joe puts into he's a second generation chiropractor. So as that, he got to see that growing up, and now Theo gets to see that growing up. And we get to see that with the kids that are coming in this office, time after time. Oh, I love that. One of the other things that fail for patient, or not fail for patients, but that patients we would want them to have a better understanding of is diet, right? That's one of the big things. We're big on supplements. I mean, I was just telling Dr. Joe, and I was like,
supplement stack.
My supplement stack is starting to look like Dr. Joe's supplement stack, but I'm feeling a lot better, right?
Because you see the value in it.
Yes. I mean, the whole hormone thing when I got my hormones checked, one of the things that I added was a supplement, and that has been a huge impact. Like 2 months into taking the supplement, and I'm like, wait a minute, this is
That's
actually
when you
working.
see the difference,
I saw
right?
the difference, right? I was telling you, and now I'm telling everyone, like, hey, maybe you need some supplements. Maybe you need some of this. Maybe you need some of that.
I think it's so cool when you're able to experience it, because now it's not just like something that you read on the internet. It's you're experiencing it firsthand, and I think that also helps with like the value, I guess.
For sure. The
conviction. The conviction. There we go.
For sure.
Like
this was, and I used to take Tylenol all the time, and ibuprofen and all that was pain. For the last 2 years, I haven't had to. Unless it's like a really severe, like very blue in the blue moon kind of thing. But it's all because I'm taking supplements, because I'm eating healthier. And that's another thing we do at the office too, is like we do carry supplements as like, and we've had patients like, hey, what do you think about this? What do you think about that? What is this supplement?
And again, we're always able to inform them, even if they're not going to get it, like, or they have doubts they're going to get it somewhere else. We at least can give them the information. I love that. Like, again, that we're always informing our patients. Like, sure, you can get the supplement from wherever you want, but read up on it first. Just don't do your research, like
either, right? Like, don't just take any supplement from the shelf or whatever. Just do your due diligence, do your work, or ask us, and we can figure.
And we're more than happy to do it.
How many times have we been like, hey, try this one out?
Yeah.
Like, hey, this might work for whatever it is that you're experiencing. So aside from, I mean, that's part of diet, right? And another thing is the food. Yeah, we want to make sure you're eating, because food can be inflammatory. Food isn't made, our fruits and vegetables. I hear Dr. Joe say this all the time. They're not the same that we were when our parents were kids, right? Or their kids and all that. So there's a lot of change in food. So knowing to read the labels, knowing that, hey, this might not be healthy, like all that processed stuff.
Yeah. I mean, it goes
diet.
With the chemical stress.
Exactly. That inflammation. And so when people don't want to change their foods or change their eating habits, that's one of the reasons chiro
might not be as effective as you want it to be.
It's not that it's not going to work, but that's not going to be as effective as it should be, right? Because you are still intaking all that inflammatory food. Sugar, inflammation is the main culprit, right? Of that, like of being sick, of cancers, of any of that stuff, like having the knee pain. It's inflammation, and let's work backwards and see where we can fix that with diet, with chiropractic care, with supplementation. But yeah,
laser, everything, acupuncture, massage.
Yes. And that's another thing with massage. A lot of people, I mean, I grew up thinking massage
was a luxury.
Oh my God, a massage, like how bougie. But my bougie ass is getting a massage now. Like, I know I need that, because it's not,
because you see that it's not a luxury. Sometimes it's a necessity. You need it to flush out or to release your muscles or whatever it may be.
We have specifically, I have from computer work, from office work, my shoulder was killing me, but Ari goes in and she goes deep, and it's our massage therapist, and I feel 100 times better. Like, I didn't know. I'm saying I didn't know that I could just have a massage when I needed it. It's not. It's medical necessity. It really, really is. It helps with inflammation, the lymphatic drainage, all that stuff.
It's one of those things though, like you don't know until you know, and now you're able to take those steps.
Very true.
For your health.
Yes.
I can't. You're able to take those steps forward to to be better. I think if anything, the last thing is like
Call for
patients.
action.
Yeah, I was gonna say
Call
if
to
patients
action.
want to get in, give us a call.
Yes.
Give us an
text us. We
email,
make it
text
really
us.
easy for
We're
you.
very, very
Promise.
accessible.
Ask
Vanessa will
questions.
answer the phone 24/7. You can call her when you're at the club and she'll answer.
Wait a minute. But yes, no, for real. Ask the questions. Like, if you're curious, if this has brought you any curiosity, like, please just text us, call
Reach
us.
out.
Yes. If you have insurance, if you don't have insurance, if you just want to go, basic adjustment, like,
If you have questions about your health,
assessment.
we're more than happy to
Yeah.
talk, to have a conversation with you as well.
Please ask the questions.
Conversations are free.
Yes, exactly. But yeah, no. And if you know someone who's in pain or needs some type of care, right? Like, reach out. Like, that's huge. Word of mouth is huge. Like, some people, like, I didn't know what chiro it was until someone introduced it to me, and that talking about it, being about it. Yeah. Call us.
Call us, text us.
Email us. Show up at the office.
Make it to your appointments.
Yes, please make it to your appointments.
But anyways,
chiro works.
Anyways, we'll be back.
For another Insights
with Ignite.
Vanessa.
Gisselle. Bye, guys.